Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, practice, and policy. Each month, we select an article to feature as a press release with an accompanying podcast. And today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today I'm speaking with a team of authors, which is exciting. I'm speaking with Caitlyn Faul and Drs. Stephanie Jilcott Pitts and Eric Calloway, who are co-authors for the article titled A Meta-Ethnography to Determine Critical Constructs of Nutrition Security. I'm really glad to have you all with us here today. And will you please tell me a little bit about yourselves?
Sure. My name is Caitlyn Faul. Thank you so much, Lauren, for having us today. I currently live in the greater Boston area and work at Boston Children's Hospital as a clinical nutrition specialist. At the time of completing this project, though, I was working on my master's of public health at East Carolina University.
I'm Stephanie Jilcott Pitts, and I work at East Carolina University. I'm a professor in the Department of Public Health here in the School of Medicine.
Hey, and I'm Eric Calloway. I'm a research scientist at the Center for Nutrition and Health Impact. We're a nonprofit research institute, and I'm currently based out of Texas.
Okay, great. Well, thanks very much. And again, I appreciate you all being here to talk with me about this really important paper. But before we get started with the questioning, will someone please give me a little bit of a background of this idea?
Yeah, so all the co-authors on this paper, I think all of them we were all kind of together working on an R01 around nutrition security measurement. Nutrition security was kind of a concept that's been emerging over the last 5 years, and really the USDA and other researchers in the field really gave it a spark and kind of made it a priority to really understand, what is nutrition insecurity and how do we measure it and how do we consider it within our programs. And as we were writing this R01, because you need measures for concepts like this, so that's what the R01 was focused on. And we were realizing there really needed to be more work to better understand what is the experience of nutrition insecurity, and also how does it differ from food insecurity. And we thought there's just a ton of qualitative work that's already happened that has looked at people's experience with food and experience with food access and getting enough food and getting access to healthy food. So we thought, if we just sort of took another look at all of the qualitative work that's already happened, we could it could probably be an efficient way to kind of tease out and synthesize some of the key aspects of what it's like to be nutrition insecure and what does that mean to people. And luckily, RWJF's, so the Robert Wood Johnson Foundation, their health eating research folks, thought that it was a good idea too, and they gave us a little bit of funding to cover a research librarian's time and to help cover Caitlyn's time. And so Caitlyn really was kind of the engine to help push this forward and make that idea actually turn into this really cool paper that we're going to talk about today. And I'll pass it off to Caitlyn if you want to just kind of talk about sort of the process of completing the paper and maybe some of the main findings.
Sure. And Eric, you mentioned the word synthesize as you were talking there. I think that's a key word to think about in terms of what we did with this project, because we completed a meta-ethnography, and that's truly a synthesis of the research out there. And because nutrition security at the time was a more emerging concept, we thought that that was the best approach to take, really with the hopes of informing policy and informing these measures moving forward. So as part of that meta-ethnography, we ended up reading through 58 different papers. We had 2 researchers independently read each paper, and we really tried to extract all of those kind of key themes from the papers to figure out a conceptual framework of that idea of nutrition security. And again, our main hope was really to have a better understanding of nutrition security measures and interventions that can improve diet quality and overall health.
Great, thanks so much. And I'm also going to say something about that synthesis. As I was saying earlier before we started the podcast, you started out with 6,700 studies.
Yes. Yep.
Impressive. And and that was another reason, as I was saying, about why I chose this particular paper, is this focus on nutrition security, and the big undertaking that you all underwent in order to pull this together into such an impressive paper. So thank you very much. I do have a couple of questions for you regarding this work. So first, given your findings, what are 2 or 3 impactful interventions or policies you think should be tested to improve nutrition security in the U.S.?
That's a great question, Lauren. I'll start off by taking it. And for listeners who haven't seen it yet, I would certainly suggest taking a look at our conceptual model to better visualize some of the constructs that we need to consider with the interventions. So our model includes 2 primary constructs, which are environmental circumstances and psychosocial functioning. And given all that we know about the social ecological framework, it's no surprise that both environmental and individual psychosocial factors influence diet quality. Within those 2 primary constructs, we then had 16 secondary constructs. So there's a lot to consider in offering successful interventions and policies, which need to address both of those primary components, really the environmental circumstances and the individual and their ability to psychosocially function in that environment. So doing that doesn't completely mean reinventing the wheel with new interventions or policies, but hopefully improving the federal and charitable food programs that already exist, right? Because in many ways, these programs have already focused on ways to increase access to and affordability of healthy foods. It's already been done with WIC, for example, since the food packages are tailored to offer nutrient-dense food programs to pregnant people and children under 5. Separate from accessibility and affordability, programs are also better targeting the education component to ensure that individuals feel confident in their ability to utilize these food options by shopping and cooking on a budget in a short amount of time. Thinking about WIC, the nutrition education component of that, or SNAP Ed are 2 good examples of that. So we really wonder if there are more ways to incorporate these ideas and components that already exist, but into other federal programs, and really take it to the next step of what it means to utilize our food options in a way that supports high diet quality. So those next steps could include interventions designed to better address some of our secondary constructs that we discuss in our conceptual model. 2 that stand out to me are stability and chronic stress. So federal programs are mostly designed to be supplemental, that can create a cyclical nature of stability as participants face more stressful food situations in the second half of the month, where they may have already used up all of the benefits that they had. So the trade-offs that many individuals battle in the second half of that food cycle certainly then contribute to chronic stress. Plus, there's just the stressful nature of ever even utilizing the programs due to the stigma around them. So seamless integration of these resources into the community is important, and we should make sure any federal or charitable food programs are provided as part of local communities and to tailor to individual needs in an inconspicuous manner to take away some of that stigma.
Thanks so much for that. And there are true direct practical implications of this work that you just highlighted. I want to go back to your specific conceptual model that you propose in the paper. What are the differences between accommodation and obligement? So, and can you give an example of cognitive coping?
So I'll speak to that. So accommodation is really how well the stores accept and adapt to the needs of the residents and community members that are using those stores or those food venues. That could be a farmer's market or anything like that. And so, but obligement is really feeling, it's kind of like on the individual level, the psychosocial level, feeling like you need to help meet the food needs of others, either in your family or your social circle. And then cognitive coping, we really struggled with some of these terms, how to conceptualize them. But cognitive coping, we conceptualized as being about how people cope with the stress in their environmental circumstances. So people in these studies that we reviewed, the participants in the qualitative studies we reviewed, they talked about how their appetites might fluctuate with their mood, or how their ideas about health and what's considered healthy really shape their choices around food and beverages. And so we consider those types of themes to be in the cognitive coping construct from our model.
Great, thank you very much. I want to touch on a little bit about what, Eric, you started with when you were describing the justification for this work around measurement. So what are the implications for measurement of nutrition security? And can you talk a little bit about the current progress on some of these measures?
Yeah, so that was yeah, like I mentioned, the grant we were writing was around creating a comprehensive measure of nutrition security. And so but there wasn't really, like a comprehensive understanding of what nutrition security is that was out there. So like I said, that was kind of the reason why we went down this path and to create this paper. And just measurement is just in general important because you need to know, the extent of a problem, where to target it, and if we're making any progress. And so the first step in making any good measure is going to be to understand, what is the thing that you're trying to measure. We still have a lot further to go on understanding, how do people experience nutrition security? And also, what are the key distinctions between like food insecurity? That's been a concept that's been around for a while. People have a good handle on that, versus nutrition insecurity. And what are the implications for like measurement and also intervention when you look at the differences between those two? And so, yeah, so this paper really helps to show that, nutrition insecurity is complex. There's a lot going on. There's two kind of major constructs that came out of this paper, and then some of the secondary constructs. And so there's a lot of things going on. There are current measures that are out there that look at nutrition insecurity in different ways, but there's no gold standard that everyone's agreed on. And so, with food insecurity, everyone agreed on using the household food security module about 25 plus years ago. And having that shared measure, for food insecurity, really helps push the field forward because, it makes it really easy to compare findings and see what's working. And so we don't have that yet for nutrition security. We're kind of just starting. The USDA is interested in aligning on a nutrition security definition and measure, and that work is kind of started. And I hope that the momentum continues. But yeah, we're really kind of in the early stages of getting a gold standard measure for nutrition insecurity. But having when we do develop that, I think the two concepts are really complementary: nutrition insecurity and food insecurity. You can think of food insecurity is really about having enough food at the end of the day, whereas nutrition insecurity is all about the quality or the healthfulness of the food. Does it meet someone's health needs? So it's really kind of the quality and the quantity sides of food access. And so we need to keep developing our ability to measure nutrition insecurity.
Great, thanks so much, Eric. And to use your own words, I'm glad you went down this path. And I think others in our profession are glad you all went down this path of nutrition security. And I look forward to the next steps and to one day having that measure, that gold standard measure for nutrition security. Well, I want to thank you all very much for spending this time with me. But before we end, is there anything else you'd like to mention?
Well, we just like to thank all of our co-authors, and those include Hillary Seligman, Heidi Reese, Cheryl Cherry, Irene Hatsu, Toyin Babatunde, Lexi McMillan Uribe, Jared McGwirt, and Rebecca Segan Fowler. And we also just wanted to thank Robert Wood Johnson Foundation Healthy Eating Research for funding this work. We're really grateful. So that's it.
Thanks very much again to all of you, and to all of our listeners. Remember, you can read this article in full at www.jneb.org for free for the next 3 months.